Virginia is looking to track wastewater in an attempt to stop the fentanyl epidemic. Jacqueline Matter is breaking down how it works. She is live tonight from Fairfax with more. Jacqueline?
Well, good evening, Jim. So it's similar to how the state was using wastewater to track COVID-19 during the pandemic, but this time they're keeping an eye on deadly drugs. Now, the governor's office says the deadly fentanyl crisis has gotten so bad that it is currently the leading cause of unnatural death in the state of Virginia, and it's an all-hands-on-deck situation. Governor Glenn Youngkin issuing an executive order directing state agencies to take 10 steps to fight the fentanyl epidemic, which includes wastewater surveillance. The state will collect samples from sanitation stations, then test them for substances like fentanyl and other opioids. Then they'll be able to look at the frequency and the potency of these drugs in specific locations. Virginia's Secretary of Health and Human Services tells me they won't be checking specific homes, rather looking at the community as a whole.
What we're really looking for, though, are spikes, right? So, if you're taking fentanyl as an authorized user, a non-illicit, that's kind of going to be a regular level. So if you have sort of an intrusion of drug trafficking and you're seeing more of it, you'll see spikes on it. And I think that's what we'd be looking for.
One doctor we spoke to says he's worried about how accurate this information would be because it could be hard to distinguish between people abusing fentanyl and those who may need it to treat certain medical conditions like chronic pain.
I'm struggling with how we're going to link the results of fentanyl in the waste to those who are using fentanyl illegally, because that's what we're trying to do here. And I'm struggling with how they're going to achieve that link.
Now, Dr. Christo says if he could make recommendations to the governor, he thinks money would be better spent on education for those who are at risk, like students, helping to reduce the influx of illegal fentanyl coming into the country to begin with, and greater information on the use of Narcan, all of which are in some way a part of the governor's 10-step plan. Back to you guys.